you, dear Chairman. I'm really honored to be here to give this presentation that show some results related to a very big project we are carrying out, which is the D-Cube for Health, that is digital-driven diagnostic, prognostics, therapeutics for sustainable healthcare. This project is being financed by the Italian Minister of Research and by European Commission within the COVID-19 recovery plan. And it aims at developing digital and biological twins of the patient cluster through an approach based on collection of retrospective healthcare data from existing database, which must be connected through an interoperating platform, and by collecting prospective healthcare data of patients, aimed not only to the validation of the digital twin model, but also to allow to take into account modification of the health parameters of the patient. And therefore, the final scope is to transform and advance current methodologies for diagnostics, monitoring, and therapy, and thus facilitating the implementation of precision medicine in order to reduce also the impact of the cost of the health system, the national health system. Therefore, the scope is to establish an e-health system to transform patient care. From patient clusters, we built up a digital twin and a biological twin, aimed to help to predict the diagnostics, but also to check the real effectiveness of the cure. The specific objectives, of course, are first to standardize how to collect data related to patients, that is imaging, pathology, omics, digital data, and so on. The second specific objective is to define and validate such approach, and using also wearable technology, enable early diagnostics, screening, and personalized care. And finally, to develop the digital and biological twin to implement and improve the cure of the patients. Methodology is then based in 3 steps. First, exploiting existing data, retrospective data collection. Second, to integrate the retrospective data with prospective data, making use also of wearable sensors. And in this sense, we will see electronic skin approach is a challenge, a frontier that we want to face and implement. And finally, create the digital twin. Of course, in order to do that, the project involves 28 partners, including research, university, research center, hospital, of course, Center for Cure and Research, and companies. And it operates through an approach, hub and spoke, in which the hub is the Cube for Health Foundation that coordinates the project, which is developed within 4 spokes. And in order to develop this technology in 4 years, which is the duration of the project, we are considering 5 reference diseases, as shown here. 3 of them are oncological disease, that is the metastatic colon cancer, liver and bile duct cancer, and central nervous system cancer. And then we consider metabolic disease, diabetes type 1, and multiple sclerosis, neurodegenerative illness. And here you see the 4 spokes. The first one mainly focused on creation of patent court and patent clusters. in order to get retrospective data. The second one is aimed to the creation of the interoperable platform to connect all data sets. The third one is dedicated to technology, wearable sensor. We are creating a research infrastructure to share this technology. And the fourth one, biological twin technologies. In particular, the focus of today is related to the activity performed we are carrying out within Spoke 3, as I said before, which develop new wearable technology, chemical, optical, breath analysis. I'm sorry. Interference. Chairman, the time is not going, so you should tell me, because it didn't start, so I don't know what time. I started at 10, no? Okay. I'm sorry. Spoke 3 is concerning development, as I said before, of new wearable technology in a holistic approach, and we aim to develop sensor to monitor all different health parameters of the patient. In particular, our group, we are mainly working on sensor technology, and in particular on graphene-based wearable sensor. And I will show you the main results and the ongoing activities. Of course, our final scope is to integrate in a multi-sensor sensing e-skin platform our devices, our sensor, and in particular, as you may know, an electronic skin system is based on 3 parts: sensor subsystems integrated in a unique platform to emulate function of human skin, signal translation, AI technologies to elaborate this data, and of course, most important is an energy supply subsystem that enable powering of the e-skin. So we are mainly working on the first and in our group and third topic, where for the second topic we are collaborating with a group of the informatics engineering. And of course we are tightly working with the medicine group, in particular coming from oncology and radiology. Electronic skin, as you may know, find 2 main applications: wearable electronic care and intelligent machinery robotics. And so we are focused on the first topic. What we want to sense? We want to sense lung movement of the heart, the different part of the body, continuous monitoring of signals such as cardio signal, respiratory rate, or to detect content from human fluid, like sweat, that give us some information about some specific illness. And the constraint we have is that our sensor must be wearable, cost-effective, biocompatible material, because we are in touch with the skin. And in fact, our group is strictly working with biotech group, and we develop several studies I will show you in a case on biocompatibility of this material. The signal must be stable, so low noise to signal ratio, easy to fabricate, and high comfort. Here you see more or less an overview of the sensor we are developing, we have developed within this project. So piezo-resistive sensor that we have integrated in a smart face mask, graphene-based smart insole to monitor working for the 5th disease, and graphene-based fabric electrode. This is very important because the commercial one are characterized by not so good noise to signal ratio, and graphene-based with sensor. This is a patented sensor that enables us, as I will show you, to get a signal which is also proportional to the content of salt in the sweet. And finally, graphene PDF composite, piezoresistive sensor to monitor movement of the heart. In particular, sensor 3, 4, 5, and 6, we are working toward implementation in electronic system. I will give you a quick glance about this sensor. The first one we realized in order to make a smart face mask, so just face mask that enables, however, to measure the respiration rate. Actually, we have integrated with the spring approach our polymer that we fabricate integrating graphene inside. So basically the mechanism that produces the piezoresistivity, of course, is the deformation of the polymer that it is integrated in the textile, the texture of the mask, and therefore it changes the effective resistance. Of course, we tested our sensor that you see here is pointer that you see here is located outside the mask, just printed, and you see here the measured signal, and we assess no effect of the measured data of the outside and inside humidity. So we place a sensor, humidity sensor, outside and inside, so the measure is not sensitive to that, and no effect of the temperature, outside and inside temperature. And another sensor, actually technology a little bit changed. We deposited the sensor on an insole. You see here the detail of the material integration, and in that case we first made the testing and validation of our sensor in the lab. Here you see durability tests and repeatability of the sensor response, and here the piezoresistive response for different sensors with different content of graphene. And in particular, this is the demonstration in real environment while working. Of course, all sensors are connected to the smartphone in order to check performance. This is another type of sensor, technology similar, but in this case we use a transfer printing technique in order to transfer the sensor, to print the sensor on the textile. And this is the detail of the material integration with the textile. And this is an example of biocompatibility studies that we perform. You see here the live microscopy of the cell, and you see the cell viability, which is not affected for different percentage of graphene filling the polymer. And of course, another important aspect is lavability. That is, the sensor response doesn't change when you wash your textile. Here is the electrodes we fabricate. Here the main problem is to enhance the signal to noise ratio, which is a crucial point, and at the same time to use the same electrode to measure at the same time cardiac and respiratory signal, which with commercial electrode you cannot do. So here you see the validation and testing of the electrodes, in which you can see there is a very high signal to noise ratio. And therefore, once we made the test here, we made the demonstration and comparison with commercial electrode. In this picture, you see the measurement from the two sensors installed on a band, and inhale and exhale, and the orange is the commercial measurement, the measurement with the commercial sensor of the respiratory rate. The red is the one obtained by our sensor, but in the blue, at the same time with our electrode, we are able to measure also cardiac rate. And so we can combine with the good accuracy both measurement. And finally, this is the sweet sensor. Actually, you see, it's just a very thin foil of material. Again, technology always combine polymer, PVDF-based polymer, and graphene in some way. And the sensor is self-powered. Basically, is an electrochemical cell. But the main point is that the signal is proportional to the content of salt. We made both immersion tests in which you see the signal proportional to the salt content. You can see the linear response, but also in the drop test with just 2 microliter of fluid, we can detect a very good signal as shown here. And this is a real demonstration of the use of the sensor and the performance of the sensor in running. This is Alessandro running on the carpet, and so we show the good performance. And finally, this is our last thermal sensor. In that case, we wanted to overcome the limitation of the commercial one, in particular to improve sensitivity, comfort, and wearability. And the other point is that all these sensors are based more or less on the same technology, so this enables the possibility to integrate in a same e-skin platform, multi-sensing platform, which is the real final aim. So, of course, we start always with graphene. We produce our GMP materials, and we produce the mixed polymer. Here you see the SEM that demonstrate the good integration of the coating, the polymer with the textile. And here you see the material. What I want to stress is the good response. This work, no delay, and the commercial sensor that is much higher degree, so there is not delay with this sensor, much faster response. In conclusion, I would say that the project aims at developing digital and biological twins for patient cluster through a data mining approach. Wearable sensor and electronic skin technologies are crucial for development of such digital twin. And in particular, in our group, we've been working since several years on the development of graphene-based nanocomposite as a promising technology to produce a wearable sensor and in the future integration in a unique platform, e-skin. And therefore, this is our future challenge. I wish to thank and to present to you our research team that these results are possible thanks to their work. And I thank you all for the attention. If you want to get further information about the project, you can go to the website or QR code. Thank you very much.